Hi, I am Dr. Kafali, and I would like to talk to you about the Mona Lisa touch, or known as vaginal laser rejuvenation, or non-surgical vaginal tightening, or vaginal resurfacing with laser. These days, vaginal laser rejuvenation, or Mona Lisa touch, got a lot of attention, and it's really popular because it's done in the office setting. It takes just 10 minutes, no pain and no downtime, and no surgery basically. And the patients can go back to their normal daily activity the same day and resume their sexual activity in 3 days. The treatment includes 3 courses of laser treatment, 6 weeks apart from each other, and the patients can have ×1 yearly maintenance treatment. Mona Lisa touch improves the vaginal laxity, postmenopausal vaginal atrophy, after delivery during the breastfeeding vaginal dryness, stress urinary incontinence. These treatments are including the inside vaginal treatment, but also Mona Lisa touch could be used for the external genital area to treat the medical condition called lichen sclerosis, vaginismus, and vulvodynia. Mona Lisa touch laser vaginal rejuvenation technique especially affects 4 different groups of patients, and it's a game changer. The main and the most common reason why our ladies come and have the Mona Lisa touch vaginal rejuvenation is the vaginal laxity. Millions and millions of ladies out there, either because of the aging, because of the postmenopausal changes, or number of the vaginal deliveries, they may actually feel little loosened in their vagina, and it can affect their personal life with their partner. Even though most of the ladies know that they need to do the Kegel exercise, sometimes they may not be able to do the right Kegel exercise, or they may not get the effect what they want from the Kegel exercise. At that time, Mona Lisa touch, laser vaginal rejuvenation, or vaginal tightening would be their really good option, especially also if they don't want to have the surgical treatment. It is done in the office, and it's just 10 minutes with no pain, no downtime, and it's well tolerated with all our patients. The other group of patients that they want to have the Mona Lisa touch laser rejuvenation is postmenopausal vaginal atrophy. With the laser probe, it's placed into the vagina. It resurfaces the whole vaginal entire inside wall, and it affects the postmenopausal dryness very well. The other category our patients are asking for the Mona Lisa vaginal rejuvenation is the postmenopausal vaginal dryness. When the ladies get into the menopause, because of the lack of estrogen, the vaginal layers, vaginal mucosa gets really dry and thinned out, and it affects the ladies during their intercourse, which makes it really painful, uncomfortable, and even during the intercourse, they may actually end up having paper cut lesions and irritations. When we do the vaginal rejuvenation with the laser, it resurfaces the whole vaginal area, and it makes the area really lubricant and really easy to tolerate the intercourse, and daily life becomes more comfortable. Until Mona Lisa touch vaginal rejuvenation, the only effective treatment for the patients for postmenopausal atrophy was hormonal treatment, which sometimes the patients, because of the personal reasons or because of the medical conditions like breast cancers, they may not be suitable to use the hormone replacement therapy. At that time, Mona Lisa touch would be #1 treatment for the postmenopausal vaginal atrophy. Mona Lisa touch laser treatment shows its effects almost immediately, and the ladies can see and feel the effect of the lubrication during their normal daily life or during their personal sexual life almost immediately. The other category the patients are looking for a Mona Lisa touch treatment is the stress urinary incontinence. As you know, aging, genetic factors, and multiple numbers of vaginal delivery could increase the chance for the urinary incontinence. And some ladies out there using daily pads, panty liners, pessaries, medications, daily medications to try to stop this problem. It may or may not work, but still the problem is there with using all those things. The difference between the Mona Lisa touch and the other vaginal laser rejuvenation devices, Mona Lisa touch can be also used on the external genital area to treat the medical condition called lichen sclerosis, vulvodynia, and vaginismus. With using the external piece of Mona Lisa touch, we can actually give the laser directly to the external genital area and see the effect of the rejuvenation on that area to treat those kind of medical conditions. And again, the effect is 90%. Many of our patients are asking how the laser works in the vaginal area. Laser directly stimulates the vaginal mucosal wall and increase the collagen production in there, which as an end result tightens the vaginal area and decrease the chance for the stress urinary incontinence, and at the same time improves the lubrication. The thing that needs to know after the laser treatment, patients can go back to their daily life without downtime. Usually also they ask when they can resume their sexual activity, which could be back to normal in 2 to 3 days. Mona Lisa Touch also could be used after the delivery when the ladies are breastfeeding. Because of the hormonal change, because of the dryness of the vagina, it could make the intercourse session really painful and dry. And at that time, again, the Mona Lisa Touch could be used to rejuvenate the vaginal area to improve the lubrication. Some of our patients are asking if they can actually have the Mona Lisa Touch treatment after the hysterectomy. Yes, they can actually use the treatment after the hysterectomy. It could be used exactly the same way how we use for our patients who does not have that kind of surgeries done in the past. Most of the time, the effect of the procedure can be seen 100% at the end of the third session. 20% of the effect can be seen after the first session, so we usually tell our patients that they have to be really patient, because sometimes they ask why they don't see the result right away after the first session. It takes some time for the body to show its effect to produce collagen. After the second treatment, 60% of the result can be achieved, but the actual result will be seen after the third session of the laser treatment. The ladies out there looking for an option without the surgery to improve vaginal laxity, to have a vaginal tightening, to decrease the chance for the stress urinary incontinence, or for postmenopausal atrophy, or during the breastfeeding vaginal dryness, yes, there's an option. And no surgery. It can be just done in the office for 10 minutes for 3 sessions. Please keep watching us.